Hi, everybody. This is part 2 of our video about knowing your rights in a healthcare setting for individuals living with a disability. Today, we're going to be talking about communication and how important it is to be able to communicate freely with your healthcare provider or clinician. I'm joined here today by Sarah Pazesh Kapoor, who's been a disability rights advocate and disability rights attorney for over a decade now. Hi, Sarah. Thanks for being here.
Hi, Jacob. Thanks for having me. And just a quick disclaimer before we get started. This guide is intended to provide accurate but general information that's current as of August 1st, 2020. This is not intended to act as a substitute for legal advice from your attorney, nor is it intended to provide legal advice for your specific situation. If you have questions or if you think you need legal advice, please contact an attorney or the appropriate agency about your rights. So as we discussed in this video, we will be discussing effective communication. And effective communication is key in you getting effective treatment. Many individuals will need a clinician to make reasonable accommodations in order for them to fully understand the information that's being provided. Whether or not you choose to bring a companion with you to your medical appointment, the doctor should address you directly and not your companion. Just because you have a disability doesn't mean that you can't speak for yourself or understand the information the doctor's giving you. You may also ask your companion to leave the room before having a substantive conversation with your doctor. You shouldn't have to rely on your family or a companion when it comes to accessing your protected health information. If you are deaf or hard of hearing, the healthcare provider must provide you with accessible communication. Most commonly, that's an American Sign Language interpreter. Studies show that deaf patients compared to hearing patients make less frequent visits to their primary care provider and make more trips to the emergency room. And this is probably due to the lack of communication access, which in turn limits access to preventative care. Remember that you are your own best advocate. You must indicate ahead of time before your appointment that you need an accommodation.
There may also be instances where you have a disability, but English isn't your first language, so you have a difficult time communicating with your healthcare provider or clinician because of this reason. Again, failure of communication can lead to a failure of care, and that's what we want to prevent here. Many healthcare service centers provide language interpretation services at no cost to all patients whose preferred language is not English. If you find yourself unable to communicate freely with your clinician, ask for an interpreter and try to let the clinician know that you feel you can't get the kind of care you need unless you can speak with someone in your native language. Most hospitals that receive federal funds are required to provide translation services, whether that means having a translator on site or other means of getting all your information to you in a language that you can understand other than English. Video conferencing may also be an option, especially during the current COVID-19 pandemic. The free translation services must actually be effective, and you must be able to access them with your disability.
For those who have hearing, vision, or speech impairments, most clinicians must provide auxiliary aids at no cost to you. Some auxiliary aids are listed on the slide here.
Another tip, if you require extra time to communicate, or if you generally cannot communicate freely verbally, you should be able to send a list of questions in advance of your appointment so that you're prepared and your doctor has a heads up of what you want to discuss. This tool will also help you make sure that you don't forget anything important during your appointment. Now we want to briefly discuss mental health. Healthcare providers and clinicians must consider what reasonable accommodations they need to make to ensure individuals with mental health conditions are not disadvantaged when using their services. This is a very complex subject area, and if this is something that affects you or someone you're caring for, you can review our companion PDF for some suggestions on where to find more in-depth information. If you suffer from a disability that affects your mental health and prevents you from accessing the kind of treatment that you need, speak with your clinician or have someone speak on your behalf if that's possible, and tell them that you need extra support during your visit or changes to their policies that restrict your access currently. For example, you may have a mental health condition which makes it difficult to understand the things that your clinician is saying sometimes, and you need an operation which carries some risks. Let's say you've been asked to sign a consent form which you don't really understand or you can't really read properly, and no one has taken the necessary time to explain that consent form to you. Because you're not able to give informed consent to the operation, you've actually suffered a disadvantage here.
We understand that self-advocacy can be very challenging at times, and that you might feel defeated after several unsuccessful attempts. There are various mental health support groups, as well as peer-to-peer organizations that you might consider joining that may be able to guide you on your path. Look for ones in your specific community and try to talk to their team members about your specific healthcare needs. Continue trying to develop a healthy line of communication with clinicians and doctors from whom you need accessible care.
Check out some of our other videos for information about reasonable accommodations, privacy, vulnerable subpopulations, and more information on where to file your discrimination complaint.